Tomatoes, bright red and bursting with flavor, are more than just a kitchen staple. They are one of the most widely consumed fruits in the world, often found in salads, sauces, and juices. With their juicy texture and tangy taste, tomatoes are not only popular but also praised for their rich nutritional content. Many people turn to them for health benefits, especially because they are low in calories and packed with essential vitamins. However, not everything about tomatoes is as perfect as it seems. While they offer a range of positive effects on the body, there are also some concerns that deserve attention. Understanding the full picture is important. On the one hand, tomatoes are loaded with antioxidants like lycopene, which may help fight inflammation and reduce the risk of certain diseases. They also support heart health, improve skin quality, and aid digestion. On the other hand, for some individuals, tomatoes can cause digestive discomfort, allergic reactions, or even worsen existing medical conditions such as acid reflux or kidney problems. These contrasting effects can make it difficult to know whether tomatoes are always the right choice. This dual nature makes tomatoes a fascinating topic for both health enthusiasts and everyday eaters. Should they be praised as a superfood or approached with caution? In the sections that follow, we'll explore both the positive and negative effects of tomatoes on health. This balanced view can help you make more informed decisions about how and when to include tomatoes in your diet. 4 positives of tomatoes. 1. Rich in antioxidants. Tomatoes are one of the richest natural sources of antioxidants, particularly lycopene. Lycopene is a bright red pigment that gives tomatoes their vibrant color, but it does far more than just add visual appeal. It helps combat oxidative stress in the body, which is caused by harmful molecules called free radicals. These molecules can damage cells over time, leading to chronic inflammation, aging, and even the development of diseases such as cancer. Lycopene works by neutralizing these free radicals and reducing the risk of cell damage. Research shows that lycopene is especially beneficial for reducing the risk of prostate cancer in men. Additionally, it may also lower the risk of certain digestive and lung cancers. Tomatoes also contain other antioxidants like vitamin C and beta-carotene, which contribute to a stronger immune system and better cellular health. Cooking tomatoes increases the bioavailability of lycopene, making it easier for the body to absorb this powerful antioxidant. This means that tomato-based sauces or soups can sometimes offer more antioxidant benefits than raw tomatoes. Including tomatoes in your regular diet helps your body build a stronger defense against disease, improves your skin's resistance to aging, and supports your overall vitality. 2. Good for heart health. Tomatoes are highly beneficial for cardiovascular health due to their unique combination of nutrients. They are an excellent source of potassium, which plays a key role in maintaining healthy blood pressure levels. Potassium works by balancing the effects of sodium in the body and relaxing the walls of blood vessels, reducing strain on the heart. A diet rich in potassium and low in sodium can significantly reduce the risk of heart disease and stroke. In addition to potassium, tomatoes contain folate, which helps regulate homocysteine levels in the blood. Elevated homocysteine is a known risk factor for heart disease, so maintaining healthy levels is essential. Lycopene, the antioxidant found in tomatoes, also contributes to heart health by reducing LDL cholesterol, commonly referred to as bad cholesterol, and preventing it from oxidizing. Oxidized LDL is more likely to form plaque in the arteries, which can lead to blockages, high blood pressure, and heart attacks. Tomatoes also have anti-inflammatory properties, which help reduce damage to blood vessel linings and improve overall circulation. Regular consumption of tomatoes or tomato products can lead to improved cholesterol balance, lower blood pressure, and a reduced risk of clot formation. These factors work together to protect your heart and keep your cardiovascular system functioning efficiently. 3. Supports skin health. Tomatoes offer several nutrients that contribute directly to healthier skin. One of the most significant is vitamin C, which plays a major role in collagen production. Collagen is a protein that provides structure and elasticity to the skin, helping it remain firm and youthful. A diet rich in vitamin C can reduce wrinkles and promote a smoother skin texture. Tomatoes also contain vitamin A and beta-carotene, which support skin cell regeneration and help maintain a healthy skin barrier. Lycopene, the red pigment and antioxidant in tomatoes, provides another layer of skin protection. It helps shield skin from the harmful effects of ultraviolet (UV) rays. While it is not a substitute for sunscreen, regular consumption of tomatoes has been shown to reduce the likelihood of sunburn and skin damage caused by sun exposure. This natural sun protection can slow the development of age spots and fine lines. Tomatoes also have astringent properties that can help control excess oil and reduce the appearance of pores. They are sometimes used in natural skincare routines to treat acne-prone skin. When applied topically, tomato pulp may help balance the skin's pH and reduce blemishes. Whether eaten raw, cooked, or used in skincare treatments, tomatoes contribute to a glowing complexion, improved elasticity, and overall skin health. 4. Aids digestion and hydration. Tomatoes are composed of around 95% water, making them an excellent food choice for hydration. Staying hydrated is essential for nearly every bodily function, including digestion. Proper hydration helps move food smoothly through the digestive tract and supports nutrient absorption. When your body is well hydrated, it can produce the necessary digestive enzymes and maintain a balanced gut environment. Tomatoes are also a natural source of dietary fiber, especially when eaten with the skin. Fiber is crucial for maintaining healthy digestion because it adds bulk to stool and promotes regular bowel movements. This helps prevent constipation and can reduce the risk of developing digestive issues like hemorrhoids or diverticulitis. The combination of fiber and water in tomatoes creates a gentle but effective support system for the digestive system. In addition, tomatoes contain natural acids and enzymes that help stimulate the stomach and aid in breaking down food more efficiently. This makes tomatoes useful for enhancing appetite and improving the overall digestive process. They are also low in fat and calories, which makes them easy to include in meals without overloading the digestive system. Adding tomatoes to your daily diet can promote smoother digestion, improve gut health, and keep you feeling more comfortable and energized throughout the day. 4 negatives of tomatoes. 1. Can trigger acid reflux. Tomatoes are naturally acidic, and for many individuals, this acidity can lead to digestive discomfort. One of the most common issues is acid reflux, also known as heartburn. This condition occurs when stomach acid flows back into the esophagus, causing a burning sensation in the chest. The high acid content in tomatoes, especially when consumed raw or in large amounts, can irritate the esophageal lining and trigger these symptoms. People with gastroesophageal reflux disease, GERD, are especially sensitive to acidic foods like tomatoes. Tomato-based products such as sauces, ketchup, and juices are often concentrated and even more acidic, making them more likely to cause flare-ups. The acid in tomatoes may also weaken the lower esophageal sphincter, the muscle that keeps stomach contents from rising. When this muscle is relaxed or weakened, reflux becomes more likely. Cooking tomatoes may reduce their acidity slightly, but it often does not eliminate the problem for sensitive individuals. Eating tomatoes in combination with fatty or spicy foods can also worsen acid reflux. If you frequently experience heartburn or indigestion, limiting your intake of tomatoes may help. Substituting low-acid vegetables and choosing non-tomato sauces can be a safer choice for those with digestive sensitivities. Understanding your body's response to acidic foods is key to managing reflux and maintaining digestive comfort. 2. Potential allergen. Though not extremely common, tomatoes can act as an allergen for some individuals. Tomato allergy can manifest in several ways, including skin reactions, digestive problems, or even respiratory symptoms. The allergy is typically linked to proteins found in the tomato that resemble pollen or latex, leading to cross-reactivity in sensitive people. One of the more noticeable symptoms is oral allergy syndrome, OAS, where individuals experience itching, swelling, or burning sensations in the mouth, lips, or throat shortly after eating tomatoes. This is often triggered in people who are also allergic to grass pollen or birch trees. In more severe cases, tomato allergies can lead to skin rashes, hives, stomach pain, or diarrhea. Rarely, the reaction may escalate to anaphylaxis, a serious and potentially life-threatening condition that requires immediate medical attention. People with latex allergies are also more prone to reacting to tomatoes because of similar protein structures. Cooking tomatoes might reduce the allergenic potential for some, but it does not make them safe for everyone. If you suspect an allergy, it's important to consult a healthcare provider for proper testing and diagnosis. Eliminating tomatoes from the diet and replacing them with non-allergenic alternatives like bell peppers or zucchini can help manage symptoms effectively. Awareness of hidden tomato ingredients in sauces, soups, and packaged foods is also essential for those with a confirmed allergy. 3. High in solanine, in unripe tomatoes. Unripe green tomatoes contain higher levels of a natural chemical called solanine. Solanine is a glycoalkaloid compound that acts as a defense mechanism in plants to protect against pests and disease. While it is present in small amounts in many members of the nightshade family, including potatoes and eggplants, high doses can be toxic to humans. Consuming large amounts of solanine can lead to symptoms such as nausea, vomiting, stomach cramps, and dizziness. In rare cases, it may cause more severe effects like neurological disturbances or breathing difficulties. Although ripe red tomatoes contain very low levels of solanine, green tomatoes, especially if consumed raw, pose a higher risk. Cooking green tomatoes can reduce some of the solanine content, but it may not eliminate it entirely. People with sensitive digestive systems or underlying health conditions should be particularly cautious with green tomatoes. Some traditional dishes use green tomatoes for their tart flavor, but it's important to consume them in moderation and always cooked. If you experience any symptoms after eating green tomatoes, it's advisable to stop consuming them and seek medical advice. Understanding the risks of solanine toxicity can help you make safer food choices, especially when incorporating nightshade vegetables into your meals. 4. Can worsen kidney issues, in excess. Tomatoes are rich in potassium, an essential mineral that supports nerve function, muscle contraction, and heart health. However, for individuals with kidney problems, particularly those with chronic kidney disease, CKD, too much potassium can become harmful. When the kidneys are not functioning properly, they struggle to filter excess potassium from the bloodstream. This can lead to a condition called hyperkalemia, where potassium builds up to dangerous levels in the body. Hyperkalemia can cause fatigue, weakness, or irregular heartbeat, and in severe cases, it can lead to cardiac arrest. For people on potassium-restricted diets, tomatoes may pose a challenge because even a single serving can contain a significant portion of the daily potassium limit. Tomato-based products such as sauces, paste, and juice are often more concentrated and can add up quickly in potassium content. Besides potassium, tomatoes also contain oxalates, which in excess can contribute to the formation of kidney stones in susceptible individuals. While healthy individuals can usually consume tomatoes without issue, those with existing kidney concerns need to monitor their intake closely. Consulting with a healthcare provider or dietitian can help tailor a safe eating plan. Substituting with lower potassium vegetables like zucchini or cabbage can be a smart alternative. Being mindful of portion size and preparation methods can help people with kidney issues enjoy a balanced diet without putting extra strain on their organs. Tomatoes are a widely enjoyed and versatile fruit, offering a range of health benefits as well as some potential drawbacks. On the positive side, they are rich in antioxidants like lycopene, which help protect the body from cellular damage and inflammation. Their nutrients support heart health, promote clearer skin, and aid in digestion and hydration. These qualities make tomatoes a valuable part of a balanced diet for most people. However, tomatoes are not suitable for everyone. Their high acidity can trigger acid reflux in sensitive individuals, and they may cause allergic reactions in a small portion of the population. Unripe green tomatoes contain solanine, a natural compound that may be toxic in large amounts. Additionally, the high potassium content in tomatoes can pose problems for those with kidney issues if consumed excessively. In summary, tomatoes can be both healing and harmful, depending on individual health conditions and how they are consumed. Moderation is key, And being aware of how your body responds to tomatoes can help you make the right dietary choices. For most people, tomatoes are a nutritious addition to meals, but for others, caution and personal awareness are necessary.